Hi students, this is Dr. Ong, and I have a neat video for you today about the endocrine function of the pancreas. And you might remember that we talked about the pancreas back at the beginning of the semester when we talked about the endocrine system, because the pancreas itself is an endocrine organ. So the pancreas is located right here, sort of where the stomach ends and the small intestine begins. And this region of the pancreas I'm going to talk about later when I talk about specifically the exocrine function of the pancreas, which has to do with digestion. So I'll show you first, before we get started, and I want to make this picture a little bit smaller, what the pancreas looks like. What the pancreas looks like at the tissue level. So when you look at the slide of a pancreas, you have lots of purple cells, and then you have these islands of lighter cells dispersed within the purple cells. And these islands are called pancreatic islets, or you may also hear them called, depending on what book you're reading or what doctor you're talking to, the islets of Langerhans, which is the name of the person that first saw them under the microscope. So, pancreatic islets, or islets of Langerhans. Hang on just a second. So, in these pancreatic islets, you have two types of cells found within these lighter colored regions here. And those are beta cells and alpha cells. And I'm first going to talk about the beta cell regions. So beta cells are really important to the human body because they produce a particular hormone that I know you've heard of called insulin. And you've probably heard of insulin in its relation to diabetes. And it totally is related to diabetes, and this is why. So I'm drawing here a pretend blood vessel, which represents the bloodstream. And inside the bloodstream, if you just have eaten a big meal, and especially if you've eaten a really carb-heavy meal, your bloodstream is going to have a lot of sugar in it in the form of glucose. And the glucose is not going to do you much good if it's found there just in your blood, but what you really need is to get the sugar from your bloodstream into your body tissues, and these beautiful circles here represent body cells. So what insulin does for you is it allows the movement of glucose out of the blood and into the body cells. So these arrows are supposed to be showing that sugar is moving out of the blood and into body cells, and this is enabled by this hormone, insulin. And what's really bad on this slide over here is that I have something wrong in there, which is saying that insulin raises blood glucose. That's totally wrong. Insulin lowers blood glucose. So ask yourself, why would it lower blood glucose? Well, because it's taking glucose out of the blood and putting it into body cells, where it can actually be used as fuels by your body tissues. So that's why in diabetes patients who can't make insulin, they tend to have really high blood sugar because insulin's not there, and insulin can't move blood sugar into body cells. So people who are diabetic, if they don't administer extra insulin, they just have lots of sugar staying in the blood and not getting into the cells where it's really needed, and that causes a lot of problems for their health. So the other topic I want to talk about related to the endocrine function of the pancreas is what the other sets of cells do, which are the alpha cells. And alpha cells produce a different hormone of their own, which is called glucagon. So glucagon is specifically produced by the alpha cells. And glucagon acts sort of in the opposite way to insulin. Move this up a little bit. So here's another bloodstream, and here's another set of tissue cells down here. And glucagon, as I said, acts in the opposite manner from insulin in that it causes movement of sugar out of body cells and into the bloodstream. And specifically, there are only some body cells that actually store up enough glucose that other parts of your body can use, and specifically these cells might be found in the liver or in skeletal muscle, because those are the body cells that can store glucose in the form called glycogen. Should be all on one line. So the action of glucagon is to actually not lower blood glucose, wrong on the slide over here, but glucagon is able to raise blood glucose by pulling sugar out of body cells and putting it into the bloodstream. So why would you want to do that? That's a good question. So if you haven't eaten, that might cause you to have low blood sugar, and in that scenario your body needs to pull glucose out of storage. So if you don't have food to eat, pull glucose out of storage in the liver. What did I just do? I don't know what I just did. Anyway, your body can pull glucose out of storage in your liver and your skeletal muscle and help use that glucose to fuel your body cells.